Age launch.
We are broadcasting. We're live. You guys caught us in a little conversation.
All right, so somebody tell us how much you missed us, because we haven't done this in a while.
Like a year, dude. Like over a year. Can you believe that?
Has it been that long?
Yeah, last one was like January of last year, I think.
Wow.
No, it's been almost a year. I don't know. It's kind of nuts, but yeah. Well, at the moment we have 0 viewers. That's probably a symptom of how long it's been.
I think it's Monday.
Monday. Yeah, I guess it is. It's also 4:20
on Friday, and I think people tend to have more free time to do these kinds of things on Friday, I've found.
That makes sense. Okay. Well, it's recorded, so
Monday they're busier, and it's Monday, which is just, I don't think anything needs to be said any more than that.
Right. Right, makes sense. Okay, so welcome to the 2015 so far edition of Therapy Tech with Rob and Roy. We're talking about taking care of your practice in 2015 because we get asked about it all the time. So I'm Roy Huggins. I'm an LPC in Portland, Oregon. Rob, introduce yourself.
I'm Rob Reinhardt on LPCS in North Carolina.
Right on. So you can see that they're very far apart.
I'm the owner of Senior Practice, do private practice consulting with a strong focus on implementation of technology like EHR, EMR, practice management systems, and also column editor for Counseling Today magazine.
Right. I guess I'll give my others as well. I'm the director of Person-Centered Tech. We do a lot of training and consulting on tech issues, especially security, but various things, just like Rob does as well. I'm also the technology chair for the Oregon Counseling Association. I'm on the advisory board for the Zur Institute. I'm an adjunct faculty member at the PSU counseling program. Sometimes I just have to remember all the things that I do. I do too many things. That's really the gist of this conversation.
I think that's partly why we haven't done one of these in so long. We both are very busy.
We're too busy. That's right. That's what it is, Rob. There you go. We suddenly have 9 viewers. It's probably just the delay. So just so you guys know, so in about a minute, you're going to hear me say, there's a delay, except it's not a minute from now because you heard that 1 minute after I said it. Oh my God, time travel. That's what's going on right now. Oh my God. Right, okay.
Whatever you do, don't try to defeat the paradox or everything will go really badly.
It'll go really badly. Don't even bother. Right. Okay, so this time we're wanting to just update everybody on what's going on in terms of the environment of private practice, especially the regulatory and ethical environment for private practice, because that's a lot of what we end up talking about. And so we're going to start by telling you some new stuff we're doing that we want you to know about. And part of the reason we're telling you beforehand is so you know what we're getting at, but also because there's a reason why we're making these things. We don't just make it up. So I am pre-launching, so it's not ready yet, but I'm giving people the chance to pre-buy what I'm calling the Interactive HIPAA Security Workbook. And we call it a workbook because originally the intention was for it to literally be a workbook, but through testing we realized that we need to make it actually like an online software thing, because the workbook is actually, people are finding the workbook very usable. The testers are finding it very usable, but there's so many pieces we realize actually it'll work a lot better if it's like web pages that ask you questions. You basically just answer some questions and it can spit out HIPAA compliance stuff that you need to know. So the idea is that this thing I'm making will do with you your HIPAA risk analysis and risk management plan and come up with a policies and procedures manual for you based on the template policies we wrote, so you don't have to write any of those kinds of things. The idea is that this system that we're making will kind of act as your kind of information technology department for your practice. And as we go along with today's show, you're going to see why we decided to build that. And Rob, of course, has similar stuff he's doing. So Rob, tell me what you're doing.
Oh, lots of things. But first I want to just say that apparently I'm special because I've gotten to take a quick look at the beta version of what Roy's doing. I'm really impressed. I think it's going to be really helpful for those of you who aren't, especially for those who aren't tech savvy, but especially even those that just don't have time to deal. There's all these things that we don't have time to deal with, but we have to. And I think Roy's product is going to really help everybody nail down this HIPAA security piece in a timely manner.
Thanks,
and it goes hand in hand with one of the things that we've packaged with Roy, which is a book Nancy Wheeler and I wrote, The Private Practice Preparedness, which is a guide to creating a preparedness plan for if you're going to retire or you have to leave your practice unexpectedly and you need somebody to take over. New stuff coming down the pipe. We just recently at Tenure Practice partnered with Hushmail. We're going to be able to offer a service where we can integrate a secure contact form in your website. We don't have that up on our website yet, but if you're curious about it, drop me an email. I'll be happy to explain it to you. And then, of course, we always have had the recommendation service for those of you looking for an EMR, EHR practice management system. We help practices locate one and identify one that's a good fit for their practice. And so that's something you may end up evaluating as you're going through this process of examining your use of technology, and you may decide, hey, we want to offload some of this compliance stuff to a third party. Let's get a system that's out in the cloud and let them deal with more of the security than us.
Right. Right, and I got to say, a lot of what Rob and I are doing is actually, like, I'm going to use the fancy business term, we're synergizing, which we actually did not do on purpose, which is another piece of evidence that what we're doing is actually following from what's happening in the environment. We're not just making up products. It turns out, for example, my workbook, when you go through my workbook, you'll discover that if you're keeping records electronically, which you don't have to do, by the way, like if you want to do electronic records, as you go through my workbook, you're going to discover that getting an online record system is probably going to make things a lot easier on you. You're going to go through the workbook, and it's going to take you through little questionnaires, and you're going to see, oh, this is why I want an online system. And then it turns out Rob happens to help people find those, right? And that wasn't planned. Even though we know each other, that's just how it turned out, because the environment is going in that direction. Now, this is only if you want electronic. I want to make that very clear. My workbook actually has extensive stuff for just, if you keep your paper files in a file cabinet, it talks to you about how to consider how secure they are. And there's nothing about the workbook that says you have to switch to electronic. That's actually kind of one of the consequences of going through this, is seeing that keeping paper files is perfectly fine, and in some ways can be easier or safer than electronic files. In some ways, less safe, depending on you and your needs. But part of the reason why Rob and I are moving towards all this, helping people with electronic stuff, is because of what's happening environmentally. And most people are probably aware that there is something in our social political environment that's trying to move us towards electronic. And that's part of why Rob is trying to help people figure out how to match well with a good electronic system, so that you're not, excuse me, stuck with something that doesn't work for you. It doesn't help you very much. And I've seen that happen a lot. And so this can actually help us segue into the main topic of today. One thing I realized, Rob, when I was talking to some people in Minnesota, where they're having a very interesting political situation, is that they actually can benefit a lot from having help choosing electronic record system, because this is the first item to talk about today. In Minnesota, starting this year, every clinician in the state, regardless of the kind of clinician, has to start getting, or moving towards getting, an interoperating electronic health record system. And so, Rob, this is your expertise, so I would love for you to help us know, what do they mean by interoperating electronic health record system? What does that mean?
Yeah, so first I want to clarify that we're talking about a couple of different things here. So if you're not in Minnesota, some of this doesn't apply yet, but you still need to be mindful of it, because obviously one state has already shown they're willing to move forward with implementing this. You certainly want to stay aware of what's happening in your state and whether there's a push. So the short version is, this is all tied into the Meaningful Use program, which was part of the Affordable Care Act. And there's a push toward electronic health records because the government said we need to reduce healthcare costs, and one of the ways to do that is by making things more efficient and having this trading of information between medical providers. So that's why there's this push to electronic health records, because the easiest way for these providers to share information is going to be electronically. And the first stage of Meaningful Use was all about getting those systems in place, getting people using electronic health records. And the second stage is about interoperability. The interoperability piece is that ability for the different providers to exchange that information electronically. So probably most of us are familiar with going to your primary care physician and you get a diagnosis for some kind of thing. And then he says, you really should talk to a specialist. Maybe you've got something going on in your sinuses, and he sends you to an ENT, or something in your bones, and so he sends you to an orthopedist. And then you go to that specialist, and you got to start all over. You got to fill out all that paperwork again and explain what's going on and your insurance and this, that, and the other. So the interoperability piece is supposed to make that more efficient. So you can walk into that specialist's office and they already know who you are and why you're there and have the records from your primary care physician and why they diagnosed you that way and so forth. So why does that matter for us? Well, for most of us across the country right now, it doesn't matter. Right now, for most of it's only psychiatrists and nurse practitioners, unless you're in Minnesota. And what that means in Minnesota, and potentially in other parts of the country, is you can be part of that interoperable system. So you're able to trade that information with other medical entities. And that can actually be helpful even outside of Minnesota, because if you can tell a physician, hey, I can receive records from you and send information back to you readily, that could be a good selling point for getting referrals.
Yeah.
One significant challenge in that arena right now, however, is even medical entities, hospitals and large medical practices who have known about this stage 2 of meaningful use for years still haven't really gotten there yet. So even though there's this mandate for people to do it, it's the reality is not quite what the ideal, it doesn't meet the ideal yet. But it's still something you want to make sure you're aware of and keep your eyes on, because it could be affecting your practice down the road. And it can be right now if you're in Minnesota, obviously.
Right. I want to jump in on this. They're not at that ideal yet, which was a strange thing. The law was written by the Minnesota legislature in 2009. I became aware of it around 2013. A colleague pointed to me. And I looked at it and I thought, this is strange. We're not going to have what they're expecting by 2015. We're not going to have this magical system of everybody being able to send records around willy-nilly, like smoothly and securely. And that turned out to be correct. It's not there. And so the Minnesota legislature has softened some of their approach to it, but they are still requiring everybody to carry on, move forward with the showing progress, which is a big thing we're seeing all over the country right now, is a demonstrating progress towards what the government wants you to do. There's a lot of recognition that we can't all be there yet. And whether it's HIPAA compliance or getting an EHR system, assuming you are required to get an EHR system, such as in Minnesota, there's a lot of this interest in like demonstrate that you're working on it. And that for a lot of people is going a very long way, especially mental health.
Yeah, I just want to underline that the key is showing that you are doing due diligence. It's like Roy said, it's the same as with HIPAA. You've got to be showing that you're making progress. And so if you can demonstrate that, hey, I'm a solo practitioner and I'm at least looking into this EHR thing, and these are what my options were, and it's cost prohibitive for me to get one, or you have some other reason, you can at least show that you're making partial steps. Maybe you're implementing a system that isn't fully certified yet, but is working towards certification.
Right.
Again, that's in Minnesota. In other parts of the country, you don't have to use that certified EHR yet, but you still have to do that progressive approach with HIPAA compliance.
Right. So speaking of EHR, because it is kind of the hot topic, let's talk a little bit about that kind of creep out from Minnesota and how it's creeping and if it's creeping, because I was at the Psychotherapy Networker Symposium a couple of weeks ago, which is fantastic, by the way. I highly endorse it. It's a really wonderful event. And there's a panel on the future of private practice, and it had big cool people who really know private practice. And there's Ofer Zur, my friend, and Joe Bavanese, and I came up and asked, so what about electronic health records? Because there was someone was talking about the future of private practice having a lot to do with integrating with medical practices. Like the big point of this one speaker, and his name is escaping me, I apologize, but like this one speaker's main point was the future of private practice is getting into integrating with medical practices and working with the doctors on integrated care. And it was actually a really great speech. He did a really great presentation on the value of that for clients, not just for the future of private practice, but for the health of clients. And so I asked, I'm like, but that's what EHR is. That's actually the point of electronic health records, is to create an integrated healthcare model of the future. That's actually one of the main points, right? That's certainly the valuable point for us as clinicians, that it makes a more integrated model of healthcare. Now, the thing is, I've talked to enough mental health colleagues to know not all of us need to do that. Many of us are in private practice because we're more siloed. Like we've gone from an agency or medical setting where we're working in a more integrated setting to wanting to just do psychotherapy and just be kind of siloed as a psychotherapist. And so in those cases, my thought is, well, there's a place for that. There's a value for that, for not being part of the integrated system. And for those people, I've actually noticed in my kind of working with them on their technology, that those are the people, especially for whom electronic records don't necessarily have much value. You know, for them, keeping a paper record system works just fine. And in fact, if you don't have a value for electronic records, it's probably safer, more secure to keep paper records, depending on circumstances. There's all kinds of reasons why I could be wrong about that. Every situation is different. But there's, for a lot of those people, keeping the paper records is often safer. I'm kind of curious what you think about that. And then I'm going to get back to my other comment about what happened at the networker. But I'm curious about your thoughts about the safety of electronic versus paper, depending on circumstances.
You know, I don't know that safety is the right word. It comes down to personal choice in the end. So here's what I see as the two keys for people who still may want to use paper records. And to be clear, even though I do this service where I recommend EMRs to you, I help people decide which one of these is going to be a great fit to your practice. I have had multiple times where I've said, you know, maybe you should just stick with your current system. Keep with paper records. It sounds like moving to electronic would be a big move for you, and you're not getting a lot of benefit. There's definitely a return on investment calculation to make there. Hey, am I going to be gaining enough out of this move to make it worth my while? And that's not always just a financial decision. It can also be a privacy and confidentiality decision. It can also be, you know, a philosophical decision, not just that financial decision. So the two things I see that will tend to either move people toward paper records or make them decide to stay there, well, maybe three things. One, if they're not in the insurance game.
Yeah.
If you're filing insurance claims, even if you're only doing out of network and you're filing for your clients, there's such a huge efficiency jump to get by using an EMR practice management system. You're able to file your claims more quickly, you get paid more quickly, you have less denials. Just those three things alone tend to make it worth making that investment. But if you're not in the insurance game, there's not as much of a drive to do that. The other thing is if you have concerns about the cloud, and I want to mitigate that by saying, you know, your stuff, and Roy's got a great article on his site about this, and we just need to make sure we link that at the end of the program. You know, your safe is generally safe on the cloud. The people that are doing electronic health records and EMR systems are held to a pretty high standard in order to be HIPAA compliant. But people have concerns about this interoperability piece, especially when you get into EHR. I don't know that I want this person's primary care physician to see everything that I've done in the clinical record. And we can get into long discussion about what should you put in the clinical record versus the psychotherapy record. You know, the clinical record is supposed to be bare minimum diagnosis and justification for the diagnosis. But even with that bare minimum, some people have concerns about sharing that information throughout the medical care system. So that would be a valid concern there. And I want to throw out a term, because you described what this is, and you may have thrown out the term and I didn't hear it, and that's accountable care organization. When you talk about physician practices starting to incorporate mental health physicians and other care, they're moving toward the accountable care organization model. The other piece of meaningful use is driving people toward getting paid for performance as opposed to paid per CPT code or service. And so part of that move toward integrated care is to put it as much as you can under one roof so that it's efficient and convenient for the client, but also so that they can use a system that shows, hey, here's what we're doing and here's how effective it is, and we should get paid more because we do really good work and we're successful at what we're doing. But like you mentioned,
can I ask you a clarifier on that one? Because I've had a lot of people, you probably get this all the time, people saying to you, okay, now we're required to get electronic records. Okay, now we're required. Or what I got last time was all social workers have to do it. Or all social workers who accept Medicare have to get an electronic health record. And I'm starting to hear that. And I'm realizing there's always been various reasons why people get confused into thinking they're required to get electronic health records. Outside, of course, in Minnesota, you are. In Minnesota, it's true. But outside of Minnesota, people keep getting confused by something into thinking they have to get an EHR system. Lately, it's been exactly what you just said, which is the quality measure reporting. And so people who take Medicare are starting to have to do that. That's the PQRS, which I can't remember what it stands for. It's like something quality, something, something. The Q is quality, I'm sure the R is reporting, right? But like that's the PQRS. And so a lot of people hear that they have to start doing that, and they hear, okay, I'm required to get an EHR system. So can you jump into that a little bit more?
I totally Googled this, so don't think I'm some master of remembering everything. It's Physician Quality Reporting System.
Thanks.
That's the joy of having two computers, us techies, and having two of us here. We can, be looking stuff up.
That's why I rambled for longer. Right.
But the PQRS is, again, it's part of that move to accountable care. Hey, we want to see how effective your treatments are, because eventually we're going to move to paying you based on that. And so part of that progress, part of that implementation bit by bit, is that now with Medicare, you've got to be doing this PQRS reporting. And if you aren't, you suffer a penalty to your reimbursement. And so people hear that and they think, oh, now we've got to have an EHR. Well, no, you just have to have a system that can allow you to do the PQRS reporting. And there are EMRs, practice management systems, that aren't fully certified EHRs that will allow you to do that PQRS reporting. Another thing that throws people, that has thrown people over the recent years, is a lot of insurance companies are requiring you to file claims electronically now. That doesn't mean you have to run out and get an electronic system. You might be using a biller who files claims for you, and they just have to take care of filing the claims electronically. But that goes back to your point of there's lots of information coming in from all different directions that seems to be indicating, hey, you've got to get electronic records. You got to get electronic records. And there's a lot of reasons to do it, but again, it comes back to that cost-benefit analysis of, for each individual person or practice, is this a good choice for us?
Right on. And so this does bring me back around to my story from the Psychotherapy Networker Symposium. I got up and I asked a question, and I said, so when you talk about integrated care in the future, we're also talking about electronic health records. And so I asked the speaker, is this part of what you're thinking about? And he was saying, no, that's not really what he was thinking about. He was just thinking about integrated care in general. But then Ofer Zur jumped in and said, electronic records are the future. Within 5 years, we're all going to be using them, right? Like there's like, just get used to it is what he said. Like he's very good at pushing that, just pushing people, just get used to it. And I was like, it's interesting because it's funny because I'm the big tech guy. I mean, Ofer is also a tech guy in the sense that he's a digital ethics guy, right? But like, I'm the big tech guy, and I'm kind of like, I don't know. I can see a future where plenty of practitioners still just use paper because they choose not to engage in the managed care system. And I know you wrote an article about this recently, so I'm curious, and you're closer to this than I am, because I'm a cash practice, I use paper kind of guy. I'm not involved in the insurance game like you're talking about. You're usually more close to that. So I'm kind of curious what you think. Is there a future where some people still just keep paper until socially paper is just not a thing anymore, right? Because that'll eventually happen, but that has nothing to do with healthcare. Right, but in 5 years or so, are we all going to use electronic records for some reason or another? Maybe because you have to use them in order to be involved in healthcare. What do you think? Where are we going with that?
Yeah, there's so many things. There's so many factors that influence that. There's certainly a generational thing. When we look at today's generation, they're constantly wired and texting and don't know what to do if they don't have their smartphone with them. And when we think about that generation growing up and becoming mental health care professionals and having complete comfort with technology, I do see a time where, the vast majority, 90+% of practitioners are using electronic records of some kind. I think there's still going to be several years where there continues to be paper usage. And I think there will probably always be some people sticking to paper because of privacy and confidentiality, current concerns, and so forth. But right now, again, I think there's a trend. It's absolutely a positive trend toward using electronic records for the reasons that I mentioned earlier, because of the gains that you get. Mm-hmm. And the big question mark out there, and I've seen this proposed at a national level, and it's not gotten anywhere, is will mental health professionals ever be pulled into the federal meaningful use program? Will we ever be required at the federal level to bring on EHRs? Because unless something happens at the state level, there's no other driving impetus for moving to medical electronic records unless you as a provider decide, hey, this is good for my clients and for me to do this. There's lots of little features that also drive that, like having your clients be able to schedule and cancel and reschedule online, getting appointment reminders, having a client portal where clients can log in and send you a secure message and pay their bill. So a lot of those features you can get individually from this service or that service.
Right.
But when you get, wow, I can have all this in one application, and it's all in one place where I can see it, and it's efficient and well organized. That tends to be the driving force. This is going to make my practice better, and it's going to make things more convenient for my clients.
Okay, so that brings me to what I really saw as a big point of today's show, which is to try to help people get a better handle on, if I do get into the new stuff, why am I doing it? And that's part of why we started with Minnesota, because unfortunately you guys have no choice. But for the rest of us, at least for now, why would we do that? What are some reasons why I would choose electronic, even if it's not something I have to do?
And it's important to point out as we get into your stuff, Roy, is that we've been talking a lot about electronic records so far, EHR, EMR, practice management systems. But it's important that most of what we've said applies no matter what technology we're talking about. Even if you've kept everything paper, but you decide, well, but I'm also going to try to use a secure email service like Hushmail. I'm going to at least use encrypted email. As soon as you step into that world of technology, you have to start to worry about that HIPAA security, compliance, and analysis and all that. So everything we've said about, hey, you've got to do this cost-benefit analysis and then decide, incorporates all use of technology, not just a full-blown practice management system.
Right. And so, and that's part of why I jumped in there when you were talking about, having a practice management system that's like a one-stop shop for clients to come interact with you outside of session. So they can send you messages, they can pay their bill, et cetera, et cetera. One thing that's starting to happen is people are starting to get used to that happening with their hospital or with their doctor if they're part of a big system like Kaiser, where there is a big system. They're used to having a place where they go log in and do those things. And there could be a shift towards clients finding that kind of thing to be normal. Because right now, when I work with my colleagues, they say, yeah, I got one of those cool systems and clients can come and send me secure messages. And some people say it's successful, their clients like it. Others say their clients just don't want to use it. But I actually can envision in terms of the future that within 5 years, the public will be used to using those. And so if you have one of those, your clients may actually even expect to be able to use one, where they can go online, they have an account with you in your system, they can log in, they can send you messages, they can pay their bill, and maybe it'll even include things like places for them to help keep them accountable with their CBT-style homework or things of that nature. That's the kind of thing I see probably happening in 4 or 5 years. And so that's the kind of thing that if you're interested in using it, that would be an advantage. Also, similarly, I don't have an iPhone 6. This is an iPhone 5, but the next version, the latest version of the iPhone has a thing called HealthKit, where it can actually start to gather health information, and it will actually transmit that health information to your doctor, is the idea. It's moving towards that. It's set up to do that, but people need to actually write software to do that. But there could be a day where your clients are monitoring their moods or other homework they want to do, and they're just doing it on their little mobile that they're with, and it automatically goes and informs your practice management system about the client's progress. And so what I'm kind of curious for people to think about is whether that sounds attractive for them or not. Like, just people watching this, does that sound attractive to you? Does that sound like something you want to engage in with your clients? Or does that sound like something completely alien to your style of practice? And I would really like people to think about, if it feels alien, does it feel alien because you're just not comfortable with the tech, which is fine. But if that's why, you may want to consider kind of learning more about it and deciding if there's value in it. Or does it feel alien to you because it just really, really isn't how you help people? Like, you don't do that kind of homework style stuff. Like, it's really about just the encounter in the room, and outside of that, I'm just a blank slate that you go visit in the room. Like, is that the style that you work with? And being aware that because of changing social norms, within the next 5-10 years, a lot of clients aren't going to be comfortable with that style. Like a lot of people aren't going to be comfortable with the idea that they only see their therapist in the room, and that's their only encounter with the therapist, because their experiences of human contact will be the sort of constant contact they get from people being in communication with each other through our mobile devices. Especially because in the next 5-10 years, I probably won't be carrying my mobile device. I'll probably be wearing it. All right. I think smartphones are probably a transitional tech. We probably will get to the point where, you know, I'm just constantly communicating. Rob and I are always bantering about something, and and it'll be very interruptive. But like that's probably what people will be used to in the future. And so you may find that you need to kind of adapt your practice to that, or not, depending on who you work with. But I think these are things for all of us to think about, so that we're aware of where practice is going, so that we're aware that things very well could change, if not for legal reasons, but because of social reasons. Like that's just where clients are. This is one of my little side rants. So I'm kind of curious if you have thoughts about that one, Rob.
Yeah, just to tie into that, you think about, again, the generation coming up, and they're so used to Facebook and Twitter and constant contact with everybody. And even if they don't all expect that with a therapist, there's a lot of good opportunities there. I mean, you know, again, this is mostly for those of you who do a measurable kind of therapy, but how many of you have sat with a client and, you know, you're trying to figure out what's happened between sessions, and their memory for events isn't exactly perfect. So there's a lot of advantages for them to be able to provide some input in between sessions through their electronic device. If you end up moving toward those quality measures, you know, that's one more benefit you get from that, is you can see, oh, over time, you know, their depression symptoms have gone down, their anxiety has improved. You're going to be able to document that more readily instead of guessing. They come in every, you know, week or two and then trying to remember everything that's happened and exactly how they felt on Tuesday last. You know, there's a lot of benefits to that. So it's like everything we've talked about. There's going to be a cost-benefit analysis, and some people are going to use it and some people aren't.
Right. Okay. So it kind of go back to my question about, is this, you know, is Ofer right? Is Ofer Zur right that everyone's going to be electronic in 5 years? I'm kind of hearing you saying you're not entirely sure that's true, but it's mostly true.
Yeah, everyone. I don't think anybody can say everyone. You know, there's always going to be somebody that's out there saying, you know, especially after Edward Snowden and the NSA and all that, there's going to be people out there say, I'm not putting anything out there that anybody can get a hold of. So, yeah, that kind of eliminates the everyone piece. But I do think that the very vast majority will be moving to electronic records.
Right.
You know, and it's not even always about the paranoia about or concerns about security. There's people who've been in practice for 30 years, planning on retiring in the next 5 to 10 years, maybe. And why should I make this big move to electronic records when I'm going to be done doing this soon? So the transitional generational period there where there's going to be people that really don't have a good reason for moving to electronic. Whereas the upcoming generation will probably start out with it, and so we'll see this steadily increasing percentage of people using it.
Right. So, okay, reasons why someone might go to electronic records. It's the law, but for mental health conditions, our colleagues outside of psychiatry and nurse practitioners, only Minnesotans experience that right now. It might be kind of something you need to move to if you're taking Medicare, because you have to start doing the PQRS, you have to start doing the reporting, and you don't have to have an electronic health record system to do that, but it does help. So if you have other reasons why an EHR might be helpful to you, you might just go take that plunge. You can make all of that reporting and everything easy. It does make it simpler to use an EHR system. You might switch to it because you're finding that it actually adds features that are useful to you, like managing your practice becomes easier. In which case, you don't need an electronic health record system, that interoperating EHR. You don't necessarily need that. Maybe you just need a good practice management system. In which case, maybe if you just get a practice management system that, you hear that practice management system that seems to be, sorry, Rob just sent me a chat message, and I'm like, what? Oh, okay. Sorry. Like, if you use a practice management, what's that?
You can wait. Finish your thought.
gonna finish with that. Right. It's just like this thought bubble appeared above Rob's head on my thing. I'm like, what? What are you talking about? So, like, if you get a practice management system that is working towards becoming an interoperating EHR, and there's a bunch of those. We've talked to a number of practice management system CEOs who say, yeah, we're actually moving to eventually be an interoperating EHR, that thing that's certified and all that. You know, using one of those could be useful because you may find right now I don't need an interoperating EHR, but maybe 5, 10 years from now I do want one. And it's really a huge pain to switch from one management system to another. So you want to make sure you pick the one that works well for you from the beginning. And those are our main reasons. You know, those are, or just, you know, you find it very helpful. I've found when I'm talking to people who are very mobile or who intend to start doing a lot more online therapy because they're moving around a lot. For those folks, we find that using electronic records is extremely useful. Like that actually makes everything work much better. For people who don't do the insurance game, who stay in one office, et cetera, we find there's really no reason to advise that they switch away from paper. You know, other than, you know, maybe just they want to start taking notes on their iPad. You know, maybe that's why they want to go electronic, is because they find it convenient. But otherwise, there's not much reason to switch away from paper for those folks.
You missed one there, and unless I
Yeah.
did out for a second, and another benefit of moving to the electronic records is to outsource some of your HIPAA compliance burden.
Exactly, right.
Allowing that vendor,
That's the next thing.
and that's assuming that you're doing something electronically. If your alternative to using, for example, a practice management system is to keep your records in a Word template on your computer, or to house your own system of some kind, you know, you're taking on a lot of compliance burden to make sure that those documents are secure and so forth. And so, you know, the other benefit of using a cloud-based system is to offload that security compliance challenge, or most of it anyway, to that third-party vendor, so that they can say, okay, we're going to keep the server secure and use all the encryption tools we need to do to keep it secure.
Right, and you can really, when you examine what's required for HIPAA compliance, the best way to avoid the hardest parts of HIPAA compliance is to hire someone else to do it, basically. And like when you use an online record system, that's what you're doing. You're hiring someone else to do those compliance pieces. You just want to hire someone who does it well, you know, and that's part of why you go check out Rob's free reviews. He has free reviews of all these systems, and then you can also ask him for specific advice if you want. You know, you can hire him for that as well. So that gets to the next piece, which is the HIPAA compliance. So next question for the last 20 minutes is, who needs to be HIPAA compliant? Like, why should I worry about HIPAA compliance? And this is actually a kind of a stickier question than you might think. And I want to point out, here I am trying to get people to buy my HIPAA compliance product, right? I just want to make sure I'm saying that, but I want to tell you, I want to give a good advice on whether or not you need it. You know, like, do you actually need a HIPAA compliance product or not? Not everyone is a HIPAA covered entity, which is that legal definition of whether or not you are legally required to comply with HIPAA. But generally speaking, if you're in the insurance game, if that's what you're doing, if you're either are a covered entity or you're going to become one very soon, because you're going to have to start moving to electronic billing. Like if you're in network, you're doing the panel thing, if you're wanting to engage in managed care, taking Medicare, anything like that, you will be a HIPAA covered entity, or you are one now. And I know that with the Medicare audits, part of what they're checking for is HIPAA compliance. So if you're involved in Medicare, being able to demonstrate your HIPAA compliance is very important. If you're not in Medicare, if you're very independent, you're not part of the managed care system, but you are paneled with some insurance companies or private insurers, you are legally required. I'll tell you from a risk management perspective, your risks are lower, because basically the question is, will you be required to demonstrate that you're complying with HIPAA? Like, at what point would you actually find yourself having to demonstrate that you've complied with HIPAA if the closest you're coming to managed care is just being paneled with private insurers? In that case, you could be randomly audited by the feds, but the chances of that are super low for a solo practice or a practice with a few people. That's like astronomically low chance that you'd be randomly audited. So like random audit is not what you need to worry about. You could get audited if someone complains or if you have a security breach. And what's interesting is I just recently did a webinar with Kathleen Mills in Texas, and she had that experience. She had somebody complain, somebody claim that her practice had breached some family member's information, right? And so the Office of Civil Rights, that's the federal office, called her up. She had to do all these questions. She had to get a lawyer. She had to deal with this investigation, despite the fact that actually she did not have a security breach. She had done nothing wrong. Nothing had gone wrong, but someone had complained. And so she had to go through this whole process. And once she started, and this is why we want to get back to the demonstrating progress piece. Once she started demonstrating progress that she was moving towards HIPAA compliance, that actually helped a lot in the investigation. Also, she was able to finally prove that no breach occurred, that she wasn't responsible for a breach. And so she didn't get in any trouble, but she did have to go through that process, and she did have to get a lawyer, and et cetera, et cetera. And so you want to avoid that kind of situation. You also want to avoid a situation where you have a security breach. And so if you're not in that managed care, if you're not a Medicare provider or something where you might actually get audited just because of the fact that you work in managed care, if you're looking at random audits or audits that are responsive to complaints, what you mostly want to do is reduce your risk of getting complained about and reduce your risk of having security problems, right? I mean, that's basically how you would reduce the risks of dealing with HIPAA problems, is to don't get complaints and don't have security breaches. And so the problem with that is that a lot of people respond to that by saying, okay, then I don't need to worry about HIPAA. And I'm like, well, maybe you don't. Maybe you can just put some security measures in place that really take good care of your stuff, have really strong relationships with your clients so that complaints don't occur, and then you'll be okay. Like, that might actually work just fine. But, right, and this is where I know you're really into this one, Rob. I have at this point had 7 different people contact me in the last year. 7 people contacted me because their email account was hacked into. And actually in every single case, no, one case it was AOL, because AOL had a big security breach last year, and that caused a lot of messes for people. But every other one was Gmail. It was the free Google email. And in every case, they called me because they had lots of client emails in their email system. And it looked like the bad guys had probably rifled through their client emails and read them. And so they wanted to know what to do next. And what's kind of interesting is, so there's two stories there that are very interesting. One is the good story, which was the story where, in this case, the person had taken one of my classes. And even though she was still using free Gmail and not doing anything extra, she had taken the relationship building measure and the administrative security measure of talking to all of her clients about what's going to go on with email, and then deciding together with them, what are we going to email about? And she says to them, assume that if we're going to use ordinary email, this is not Hushmail, not encrypted email, this is just ordinary email. If we're going to use it, assume that there are, just as a matter of course, various people who can see our emails. And so is there anything that you are still comfortable emailing with me about if random strangers can see our emails? And so of course, actually nearly every client said yes, scheduling, things like that. I don't care if random engineers and hackers and administrators see when our schedule is, right? So we'll email about that, but I won't email about anything else. So this is, out of the 6 stories that had to do with Gmail, this was the good story, because it did have a security breach. She did have to tell all of her clients that she'd had a security breach. And what happened is every client just said, oh, that's too bad. Oh, well, right? And it was fine because she had already done that measure, that very strong security measure of collaborating about what they're going to communicate about. So the fact that the breach occurred ended up not mattering. The risk was so low, the issue was so low, her clients didn't care. But because of ethical and legal regulations, she still had to do the whole report. But probably that there wasn't really any negative outcomes because there was no harm done. Now, in the other 5 cases, I don't know about the client outcomes. I don't know much about that. It probably wasn't too bad either, to be honest, depending on what they're emailing about. But in all those cases, I did what you're supposed to do under the law, which is I helped them investigate what happened, try to see if we can prove whether or not the bad guys didn't actually read the client emails. But in every case, it looked like, yeah, the bad guys probably did read the client emails because they're reading all the emails they can because they're trying to look for interesting information. And so it's like, so you have to report that. You have to tell people about that breach. And in those cases, I don't really know how that came out. But here's the kicker. Here's the bit that I know Rob's going to smile about, because Rob has been doing this exact same thing I have. If they had done the thing they're required to do for HIPAA compliance, which is called a risk analysis, meaning ahead of time you take a look at what you're using and you look for security holes and you look for ways to make your security better, right? If someone had done that ahead of time, in every one of those cases, and this is the reason why I mentioned that it's Gmail, because Gmail does this. If they had turned on this one feature of Gmail called two-factor authentication, right, which is where basically after you type your password, you also have to like get a text message and then enter the code that's in your text message. So you password and then you get a text message and then you type the code from your text message into the screen, right? That's called two-factor authentication. All 7 of those people, well, all six who were using Gmail would not have had any problems. There would be no breach. I almost pretty much guarantee none of them would have had to call me about anything if they had done that. If they had set up the two-factor authentication, none of these bad guys would have been able to get into their accounts. And the thing is, if they'd done a simple risk analysis, which HIPAA requires, they would know that, and they would never have had that breach, right? I would not have had these 7 consults. It's like, for me, I made money, so, you know, thanks, you know, like for not looking that up. But I'd much rather make money helping you prevent that in the first place than on helping you respond to it. Because honestly, these days, like, helping people respond to security breaches is actually becoming kind of profitable for me, but I hate that. Well, I like it because I can be there for them. It's good to have a counselor help you through that, because it's such an anxious time to be having to talk to a consultant about a security breach where you're worried that your clients have been hurt. So it's nice. I know it's nice for them to have a counselor help them with that, as well as a techie. So I'm glad I can be there for that, but I'd much rather be there to help people prevent that stuff from happening in the first place. And so I know you're going to smile, Rob, because so you go ahead and jump in with, I know you got a comment about this, because Rob has been trying to get people to do this too.
I've got a couple of comments, and I don't have any stock in Google, and we don't get anything for this, but please Google or whatever application that you're using that allows for it, use dual authentication. It's also called two-factor authentication. Here's what this is on my tablet. Let me see if I can pull it up. Let's see.
Oh, demonstrate it. Great. Yes.
Okay, so that's the little code that shows up. I'm covering my email address just in case somebody out there knows my email address and password. That's my personal email address. That's just a little 6-digit code that's on my little tablet. I don't know if you can see the little timer on the right side. It might be on your left side. See the little timer that goes off. So it's like every 20, 30 seconds, it spits you a new code. So when you go to log into your Gmail, you have to not only type your password, but then it'll prompt you for that code. So even if someone has managed to guess or steal your password in some way, maybe over an unsecured Wi-Fi connection at a coffee hut, they still can't get in, because it's going to say, hey, you have to enter this other code, and they don't have it. So it's just an easy step that you can take with so many different applications these days that gives you that added security. I strongly encourage people to do that. And the other thing I want to put out there is, you talked about, oh, someone hacked their Gmail, they got a hold of their password. But here's the thing, and Google's not the only one that does this. There's other email services that do that. There is nothing free. There really is nothing free. Google is happy to give you free Gmail because they scan them all. They use that information to sell people stuff. If you notice, when you use Google, you see ads spit up. Well, that's because Google has little robots, computer programs analyzing emails and saying, what is this person interested in? Let's show them advertisements that correspond to that. And so when you talk about emailing clients over regular Gmail, Google is using that information. There's not a person sitting there at a desk reading it all, but there's a computer programming analyzing it in order to decide what kind of advertisements to show people. So it's not just about getting hacked. A lot of people are around, oh, I'm using a secure password, so it's okay. But if you're using regular Gmail, you still have those other activities going on.
Yeah, and well, that's interesting. This also brings in the aspect of risk analysis, which is why it's you and I can actually jaw for a good 20 or 30 minutes about all the different security implications of Gmail. And the confidentiality implications, just the ethical implications. And we actually probably can jaw about it for a couple hours and not even use a lot of techie jargon. I mean, we can make it very clearly spoken to everybody, like what we're talking about. And we could all get that because it's a complex issue. And that's actually why HIPAA compliance requires that you do a risk analysis, not just get a checklist of, okay, I got the right product, I got the right product, I got the right product, or I turned on the right feature. It's like you need to actually analyze what's going on for you and your practice and your clients, and is it acceptable? Is it by acceptable means?
And the example I always use is you can have a Hushmail, a secure email account, or this awesome practice management system. But if your password is 1234,
yeah,
purpose. That's part of risk analysis. Is okay. What are the risks here? Well, the risks include how strong of a password am I using? Am I using a password that somebody could guess and get into?
Right.
So it's not just about the tools you're using, but the process of using them.
Right. And so I want to say, because we're going to bring it back down, because obviously the only reason we're here is to sell things. That's why Rob and I are chatting about things we've
There's been no useful information presented so far.
Right. So the workbook I'm making, what it will do is actually just talk you through everything Rob and I just talked about. Like the workbook knows all of these things we said. And so when you tell the workbook, oh, I'm using this email system, or I'm using email, the workbook will talk you through, well, okay, how are you protecting the email? Well, here's something you could do. Here's another thing you could do. Here's another thing you could do. And it actually uses a point system where you just get points for the things you're doing. And if you get enough points, then you can leave it alone. If you don't get enough points, you have to add things. And that's how it works. That's actually how this workbook works. And it's meant to be your own pocket, me and Rob, kind of taking you through all of these questions. Although, I mean, it's still important for you to see things like what we're doing right now, because the workbook will tell you, okay, go over here to turn on the two-factor authentication. It's still useful for somebody like me and Rob to help you understand why you're doing that. Because if it just feels like a pain in the butt and you don't know what it's for, you're not likely to really maintain it well. So having things like this free show is always valuable. But this thing I'm building is meant to just sort of be like that robot who sits with you and says, well, Rob and Roy say that here's a danger that you're looking at because of the thing you're using. Here's something you could do to mitigate that danger. Is that going to work for you to do it that way? Or do we need to help you find a different way to mitigate that danger, depending on what your needs are and what your client needs are? Because honestly, like the thing about the Gmail ads is that from a classic ethics perspective, that's a confidentiality breach, right? If you're using Gmail at all, right, the Gmail robots, as you put it, are scanning your emails, building advertisements out of the emails, which would technically, from a classical perspective, a very restrictive classical perspective of confidentiality, would be a confidentiality breach, because unauthorized parties, people who aren't, the people your client said you're allowed to release this info to, they're seeing the client's emails, right? So technically you have a confidentiality breach. But if we take it from a risk management perspective, a security perspective, we look at what's happening with the client's confidentiality, which is robots are scanning the emails, looking for advertising information. Okay, that could be good or bad. That could be terrible. That could be not a big deal, right? Depending on the client. So if I've talked to my client ahead of time about what to email me about, and I say things like, hey, I use free Gmail. It's going to scan your emails looking for advertisements. And actually, there's a pretty decent chance that if you talk to me about depression, you're going to suddenly start seeing ads online for depression medicine because you're talking to me about depression in your emails, right? So let's not do that.
Companies have a lot of
Say that again?
And because pharmaceutical companies have a lot of money to spend on advertising.
Right. Which is why I would assume that what you're going to see is this depression medicine ads, right? If you're talking to me about depression. So I'm assuming that's probably what's going to show up, right? So I talked to a client about that, and the client either says, I don't care, that's fine, whatever, I'll just ignore the ads. Or they say, oh, okay, well, then I won't talk about that, right? Once again, it's all about the ahead of time, and it's about looking at what the risks are and working with the clients to decide what risks are acceptable and which ones aren't. Clients may not care that their info is being used to make advertising. They're like, whatever, I have much worse things going on with Facebook than worrying about your Gmail account, right? And clients can make that kind of decision, but they have to make an informed decision, right? It's all about an informed decision, and that's why you need to do that risk analysis. Like when HIPAA requires us to do that risk analysis ahead of time, find out what's going on ahead of time, they're not just being pedantic, mean, draconian people. Like the HIPAA law says to do that because it's a good idea, right? To ahead of time know what's going on. And the thing is, for me and Rob, it's easy to say because we're techies. We can look at our stuff and know what's going to go on and do a risk analysis. And we can talk all day about how you should do one too. And that's very easy for us, right? And that's exactly why I'm building the interactive workbook, right? Because I'm tired of telling people do a risk analysis, and then the best I have for them is to say, it kind of looks like this. Go, good luck, best of luck with that, right? Like, I'm tired of doing that. So we're building something that you can use.
And I want to jump in here and just blatantly plug your stuff, Roy. Back when I started doing this consulting thing 3 or 4 years ago now, one of the first things I thought of is, wow, we really need something that walks us through this process. A couple years in, the government put out this tool that's real kludgy that can actually walk you through the process, but you have to know what the questions that they're asking mean.
Yeah.
If you're not a techie and you don't understand HIPAA security, it's not very helpful at all. And so, shortly in, I met Roy, and I'm like, well, he's doing this HIPAA security thing. I can really focus on the implementation of the actual software. So I'm going to leave that to him. But when I got to look at what Roy's done, it's very close to what I had envisioned as being this very user-friendly tool that walks you through the process. Which is what everyone needs. I mean, everybody's starting to understand why they need to do this, but this walks you through. It relates things to stories that you understand. It's not tech heavy. It explains what you need to know, but it does it in a manner that you understand. Roy is great at relating the tech stuff to the counseling and therapy stuff. Saying, hey, you probably do this in counseling and therapy. Well, it's the same concept over here. With the technology, and here's why you're doing it and how to do it, and boom, 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 walks you right through the process.
Right on. Thanks, man. I appreciate the endorsement. Yeah, and I'm glad you see it that way, because that's exactly what I was aiming for. And once again, I really want to emphasize exactly what Rob's saying. Both of us have thought to do something like this because it becomes immediately apparent that it's needed. There's a really big gap between what's required and what's possible. Right? Like, what's required is to do this whole process. And actually, Rob and I have discovered in the years we've been working with colleagues that you guys, we're all capable of more than we think, especially when it comes to tech. We've worked with people on doing this process themselves, and people have gotten through it, and they've figured it out. But still, I mean, like Rob's saying, you don't have all day long to work on your practice management, right? This is one of the reasons why people end up avoiding the whole process and not being in compliance with the law, which seems so weird to say. That 95% of us are not in compliance with the law, but we're not. And it's partly because it's too much. It's like, I don't have the time to do all that. And so that's why we're like, okay, we got to do this workbook, because this year, 2015, what's going on with Minnesota, Minnesotans need it. People who take Medicare need it. And in general, as tech gets more, all over the place, we all kind of need some kind of guidance. And so definitely the tool, I want to make it very clear, the initial version of our tool is definitely to help with HIPAA compliance. So it will do all the extra steps that are meant to meet HIPAA requirements. So if you want to use the tool just to help get your text straight, it'll do that. It'll absolutely help you get your text straight, plus a few other things that have to do with HIPAA. So if you're not worried about HIPAA, it will go a little deeper, a little further than you need, because it wants to make sure you're HIPAA compliant as well as just doing your tech well. But it will also do that. It would also just help you get a good handle on your tech and making sure you're taking care of your clients. And probably in the future, we'll have a version of this system that's a little lighter weight, that's just meant for people who want to get a good handle on taking care of their clients with tech and don't care about HIPAA compliance. But for now, it's meant to help with HIPAA compliance. And I should also say, Rob and I have a package. You can buy as one package with a discount the workbook. You can pre-purchase the workbook plus Rob's time for choosing a practice management system or EHR system. We have a package for that. You save about $45 by buying that package. You can also package the workbook with Rob's book, the Private Practice Preparedness book. That will help you be prepared for if you have to retire suddenly or become lost or pass away or something. Helps you pass helps you help your clients along to the next stage with things. And you can buy that one.
In one of the previous therapy tech shows, Nancy Wheeler, my co-author, joined us, and it talks more about that book. And of course, you can find more information about it at privatepracticepreparedness.com, including the templates it has a description of the templates that come with it. Similar to Roy's workbook, it walks you through creating that plan.
Right, exactly.
Oh, I need to throw in one more plug that's totally unrelated. Can I do that? Can I?
Yeah, of course.
Okay, perspectiveexploration.com or describecards.com. For those of you watching right now or who see this within the next couple of weeks, if you get there, you sign up, you're going to get regular information about this new product I have coming out that's totally not technical at all. It's actually a tool you can use with your clients. I'm going to be giving away some free copies for everybody that signs up for information. And over the next couple of weeks, I'm going to be putting out more and more information about what it is. But I'm not going to tell you any more right now. You got to go sign up on the website to find out.
Okay. I was going to say it's cards. It's weird. It's coming from Rob, but seriously, it's nothing to do with tech. It's just paper cards. Like, really.
Technology involved at all. It's crazy.
Right.
Except for the website where you go and sign up and say, yes, I would like more information and a free copy. Maybe.
If
you win. And here's the thing. You can spread the word. You tell more people about it, and the people that you tell about that sign up, that gives you an extra entry, so you have even better chance of winning.
It's like Amway.
No. I guess they yes. You don't have to sell anything. All you have to do is tell.
Right. Sorry, Rob.
Right. You need to. Do you have a URL for people to go to find your package?
Yeah, I do. I'm going to put it on the page. So to find the resources we talked about today, go to the show page where we have the information. I'll send another email out to those who registered, and of course, we'll be telling everybody about this show. If you found anything helpful in this show, please tell your friends. Not just so they'll buy the workbook or the cards or anything like that, but we're hoping we're helping you guys out, because that's definitely what we like to do. We love to help. And
yeah, we appreciate. I get a lot of. I'm sure you do too, Roy. I get a lot of positive feedback from people about the show, saying that they're glad that we're doing this. So thanks for letting us know.
Right, and we really appreciate that. And yeah, definitely a great place also to ask questions about the show or follow up is my LinkedIn group. I'll also make sure there's a link to that, because we have an entry on the LinkedIn group about the show. It's a good place because you can get feedback from more than just me and Rob. You know, there's lots of good people there who love to talk about this stuff. And also it's a place where Rob and I can both see your comments and see your questions. So like, it's not just my website or Rob's email or my email. It's a place where we can both see it. So yeah, we will see you guys next time we do this, which will hopefully be sooner than a year from now.
Yes, hopefully at least one more this year.
Yeah, at least, right.
Okay. If you have ideas, you have something you'd like for us to talk about, actually drop us a line, let us know.
Yeah, we would love to do that. Yeah, and you can see right now, we're both happy to talk. We don't have to have something to sell in order to talk to you guys. All right, you ready to go?
Yes.
Okay.
Thank
See
you,
you guys
everybody.
later. We're going to stop broadcast.